Aboriginal communities, organisations and colleagues here today. I feel very fortunate to be standing on Gadigal country of the Eora Nation, and I commit to allyship, learning, listening and continually reflecting on the work Domestic Violence New South Wales must do to support and facilitate meaningful change. Of course, we do this work with our incredible Senior Aboriginal Policy Officer, Raelene Hassel, and the Aboriginal and Torres Strait Islander Steering Committee. This work remains so important and, of course, ongoing. We have a big sector chat before us here today, and before I introduce our amazing speakers and lineup, I have a Domestic Violence New South Wales update for you all. So let's jump in. This is a very exciting year for us as it's our 50th birthday. Our organisation was born out of the Women's Refuge movement in 1974, and in 1983 we became the New South Wales Women's Refuge Working Party. And then only as recently as 2013, as I'm sure many of you know today, we took the name Domestic Violence New South Wales. More importantly for all of us here today, 2024 marks the 50th anniversary of the sector. And as we move through this year and towards our future, it's important to acknowledge those that went before us and celebrate the work of those who are part of our journey now. Today, I'm excited to give you a preview of the plans for the year ahead, which will include a refresh of the DVNSW logo, campaigns to support our 50th anniversary year, and of course our conference. So over the past few years, we've been evolving our visual identity to better reflect who and what we are and what we mean to our key stakeholders. You may have noticed this through our updated website last year and in the way we present our submissions, reports and communications. Refreshing our logo was the next step of this evolution. Our members and stakeholders have told us through conversations, surveys and unsolicited feedback how we're perceived and what's important to them about DV New South Wales. We've used this along with our values and our aspirations to inspire the evolution of our visual identity. We knew our existing brand mark was not communicating all of our strengths and was missing some key elements, especially around inclusiveness, connection, approachability, and the two-way communication and advocacy that is so important to us and to you. And of course, we celebrate that brand mark. It's a huge part of our history and we know the work that went into that, but it's also important we can evolve as an organisation as we turn 50. So, ring ding ding. I am therefore delighted to share this with you today. We're not officially going live with this for another week or so, but we wanted you as our members to be the very first to see our new branding. The refreshed brand mark is a gentle and considered evolution from where we are now. It builds on what we have and it modernises us to give us a fresher approach that doesn't throw away our heritage, which is so important to us. It uses our initials in a way that demonstrates our capacity to communicate as we're active listeners to our members, and it advocates to our decision makers. It is strong without feeling overbearing and aligns to our positions as leaders in the space with confidence and gravitas, without being imposing or commanding. We're so proud to move through our organisation's 50th year with a fresh and modern brand identity that truly reflects our purpose and who we are. So as we started planning our 50th year, we were very clear about what we wanted to achieve and what would be possible with limited resources, bearing in mind we're such a small team. We knew that it should be grounded in a way to truly honour the sector, those that went before us, as I mentioned, and those who are doing the truly tremendous work now. We wanted to make our 50th year an opportunity to educate the public and create ongoing awareness so we could really create meaningful change. This messaging and work would also reach our decision makers and influencing. Furthermore, we wanted to do this in a way that we could share with our members. So whether your service is young or old, it's part of the sector and we're doing amazing things as we turn 50. Therefore, we have developed a 50 Years Against Gendered Violence logo, which draws on the incredible imagery of the 1974 movement as its inspiration. We will provide all the artwork to our members for your own use so that you can support the campaign in any way that benefits your organisation, whether that be internally for staff and your team, or work you might be doing in community or around fundraising. You may have noticed that the team today are wearing the new t-shirts with our new logo on the front. What you won't have noticed is that on the back, we have our 50th year logo, which of course is coming to you soon if you didn't catch that. So All of this work will be included in the new 50-year section of the updated website, which will go live in March, and which of course will include information on the advocacy priorities for the next 50 years and the things we want to see around systemic change. So I'm 6 minutes in, I've got 4 minutes to go, so I don't want to blow everyone else's updates, but I've got a few key things to tell you about the year ahead. So the rest of the year, we'll launch our 50 years campaign on International Women's Day with a pledge to end domestic violence. This will be hosted on change.org, and we are thrilled to be making this announcement alongside Rosie Batty, AO, who is supporting the pledge campaign. The pledge will include 4 key pillars for change, more details coming. Our aim through the launch of the pledge is to generate media coverage where we get the opportunity to talk to the public and create awareness of the role our communities play in ending domestic and family violence. We also hope to use it throughout the year to create more awareness of the sector with those key decision makers and influencers. We'll be providing more information, including social media tools and links on the day, and hope you'll help us getting the message out. May is, of course, Domestic Violence Awareness Month. And this year, as part of our 50-year celebrations, we want to increase public awareness and acknowledgement of the work of our members. We are creating a video campaign titled 24 Hours on the Front Lines, where for each hour on the clock, as you all well know, domestic and family violence is 24 hours around the clock, right? We'll be profiling key frontline workers and their service across those 24 hours. Also for Domestic Violence Awareness Month, we're offering to facilitate film screenings of films that largely focus on those advocacy priorities I just spoke to, which of course we'll be sharing in March. For more information, if you'd like to organise a screening, please contact Jo, and details in the chat box. There's a lot of information coming your way. So we are recording today, and there will be key information in the weekly newsletter as well. So don't worry if you're not keeping up with my 2 minutes to go voice. So September's our biannual conference. It should be no surprise at all that it's going to be titled Past, Present and Future. The conference programme is shaping up to be an amazing 2 days of learning and networking. With a great lineup of speakers and panels, we're going to lean into our history, with stories from the front lines and the start of the sector. And we'll look at the issues we're facing today and what we need to do to look forward as a future. Programming and ticketing information will be available on the website soon. November, of course, is the 16 Days of Activism, and we'll be wanting to focus our 16 Days of Activism on our 50th year anniversary with our members. We're currently working on a mural series throughout New South Wales. We envisage that this will be a mix of faces from the front lines and artwork depicting the journey to end domestic violence. Whilst this is still in the early planning stages at the moment, we're still keen to work with members in their local community to help facilitate this project through the local council. Please reach out to Jo and the team on dvnsw.comms at dvnsw.org.au. And again, that will be thrown in the chat box because that's a mouthful, of course. So lastly, as we move through this exciting and momentous year, we're conscious that we are celebrating a significant milestone in our sector, that much has been achieved, but of course there is still so much more to do. We're so proud to be part of this with you, our members, and we want to mark the history of the 2024 year to be very, very proud of our members, look at where we've gone and look at where we're going, and want to just say wholeheartedly right now for this sector chat, huge thank you for all you do. So whistle stop tour on 2024, and of course, you know, there'll be emerging issues that come out of government. There's still advocacy, sector development, member engagement. So there's lots happening for the small team this year. So wish us the best of luck. We want to do everything with you. We'll keep you posted, and I will now move on to our speakers. Thank you, everyone. As you know, today we'll be hearing from Domestic Violence New South Wales regarding the quality standards, and following that, DV West on their We Are Safe and Living Outcomes report, which can't wait to hear. Firstly, we'll hear from Domestic Violence New South Wales. I'd like to introduce you to Carrie, McKeon and Danielle Thompson, who some of you may already know now due to their consultation work. They are going to be providing an overview of the Quality Standards Project, an exciting 3-year co-design initiative that aims to develop quality standards framework for the New South Wales specialist domestic and family violence sector. The Department of Communities and Justice has engaged Domestic Violence New South Wales to lead this important work, which represents the next critical step in building on the good practice guidelines to improve service experience for victim survivors and provide a framework to measure and showcase the quality and impact of service delivery and practice across the specialist domestic and family violence sector in New South Wales. Carrie and Danielle recently delivered the National and International Domestic and Family Violence Quality Standards Research Summary Report, huge title of course, to DCJ. And today they will share the key findings from that research. They'll also be providing an overview of the sector consultations that will be taking place from now until July, which will help inform the co-design of the framework and implementation approach. So I welcome the awesome Carrie and Danielle to the floor, and thank you, members. So great to see you all.
Thank you, Delia, for the intro and overview. I'll just share my screen. And hello, everyone. I'm Carrie and joining from Dharawal land today. And I've got Danielle on the line with me as well. She's a project officer and she'll be co-presenting with me today. Just give me a thumbs up when you can see my screen. All good. Okay. Excellent. Thank you. Thanks. So, so thank you, Delia. Your little intro there kind of takes care of our first slide or two. But yeah, as Delia said, this project has been funded by DCJ, and it's a 3-year project where we're aiming to co-design quality standards for the domestic and family violence sector in New South Wales. So I'll start with a overview of the project timeline. So you can see here this spans across the 3 years of work. In phase 1, as Delia touched on, we established the team and kicked off the project. We undertook desktop research on national and international approaches to domestic and family violence quality standards. We produced the research summary report, which Delia mentioned, and Danielle will go through the key findings in a moment. And we undertook planning in the lead up to the sector consultations. So you can see phase 2, we've got a little pin there. That's where we're at now. We're undertaking sector consultations throughout New South Wales, February through to July, and we're delivering a consultation report based on the learnings and co-designing the draft standards framework. In the final phase of the project, we'll be user testing that draft, establishing a working group and undertaking a second round of consultations specific to the draft and implementation on the ground. So phase 3 will also include co-design of the final standards as well as implementation recommendations. I'll hand over now to Danielle to go through the research.
Thanks, Carrie. So yes, as Carrie mentioned, I'm Danielle. I'm the project officer for the Quality Standards Project. So as mentioned by Carrie and Deals, we did kick off the project with a bit of research. So we underwent a review of existing standards. We looked at standards both in Australia and internationally, so 35 standard documents across Australia, and then also 18 sets of standards in countries internationally. As we were doing this, we were comparing standards that existed with the good practice guidelines, the DV New South Wales good practice guidelines that you may hopefully have already seen, and just comparing what that document looks like in comparison with some of the standards that exist already internationally and in Australia. So with the standards that we looked at in Australia, we looked at both in the domestic and family violence sector specialist DFE standards. There isn't a huge amount of standardisation in Australia. So we also looked at practice guides for the specialist DFE sector that exist across states. In Australia, in terms of DFE practice standards that exist or codes of practice that exist, there are a set of standards in Queensland which are mandatory. It's an interesting document because it does look at standards for the services or organisations working with victim survivors, as well as with services working on intervention programs for perpetrators. So that was a combined standard, which we didn't see anywhere else in the country. With Victoria, they have both a voluntary set of standards, so a whole set of standards for the sector, the Code of Practice. So the second edition of that came out in 2020, but as a result of the Royal Commission into Family Violence, which finished up in 2015 in Victoria, there's been a huge amount of change in the state and the sector. So there has been different things coming out. Recently, they've introduced and implemented case management program requirements, which are mandatory for specialist DFE services in Victoria who are providing case management. We also looked at WA. So at the moment in WA, they're actually developing fairly similar to what we're doing here now, a code of practice there. So the standard is being developed in WA. Their project's just in front of ours. So they're about 6 months ahead. So we've had a good opportunity to talk to them about their approach and share some of the research, which has been really fantastic. And then we've also looked more generally at standards across New South Wales, so standards that operate for the whole human service sector and more generalist or other sector standards as well, like child protection, for example. But yeah, the standards that we looked at in terms of human service standards, most other states or many of the other states do have a standard that exists for all human services that are funded. So for example, in Victoria, that's happening in Queensland, South Australia and Tasmania, and that's not something that we do have here, but many of you are aware of the introduction of the ACES standards, so the Australian Service Excellence Standards that's rolled out for the specialist homelessness services in New South Wales. So that's something that we were also looking at as we were doing this research. Internationally, we also looked at standards across different countries. So we reviewed specialist DFE standards in Europe, in Ireland, the UK, Canada, and New Zealand. We looked at Europe. It was one of the first standards that we could find that was a good example for us around, and it was introduced in Europe to sort of create more consistent practice across countries within Europe. So that was a really interesting example. Then we also looked at Ireland, which came next in those sort of that European part of the world, where they've introduced, it started as standards for sexual assault services. And then there's been more and more standardization happening across Ireland and the UK. Part of the push behind this is a treaty that was signed by many of the countries in Europe and then also the UK and Ireland in 2011, which is a treaty around combating violence against women. So that's a legally binding treaty that many countries have signed on to, which has meant that there's a lot of sort of government push and motivation behind standardizing and professionalizing and building up domestic and family violence services in those countries. We also looked at an interesting example in Canada. So it was difficult in Canada, like Australia, there's lots of different jurisdictions, states doing different things. But we looked at a model called the Flourishing Practice Model, which is actually a sector-led model of practice for specialist DFE services. I think there were 70 different professionals got together across the country and sort of defined principles for their sector and also defined key skills and competencies that the specialist DFE sector use every day. It was a really interesting example, demonstrated a really Indigenous-led approach and really tried to highlight sort of First Nations wisdom, and it was a great example to look at. New Zealand, which we looked at as well, had a similar approach. Its model was quite different to the other standards, those in Australia and Europe and the UK. It too really focused on a more culturally safe approaches to practice. And even the way the document was read, it really, written and presented, it really stood out as a quite different approach to some of the other models, which is something that we're looking at and thinking about how and what parts of that we can implement as we go into consultation or find out more about. So through the analysis of the different standards that we looked at, we came up with some key themes. So they're listed here. So safety, risk assessment, approaches to perpetrator accountability, approaches to inclusion, access and equity, cultural safety, child focus, governance and leadership, use of language. So that's the language used in the document itself, implementation approaches, workforce capabilities and minimum qualifications. So we looked at core competencies. Many of the documents had a capability framework alongside them. So a lot of the standards will produce both. And then we also looked at structure, content and style of different documents. So the way they're written, the way they're presented, how they look. The analysis brought us to 33 recommendations. So the recommendations are a combination of things we want to explore further through consultation. So as mentioned, we looked at lots of different documents and there were lots of key themes that stood out, particularly around areas of practice. We do want to look at how that's sort of happening in New South Wales, and then also, just generally gauge, what the sector and the state wants to see in terms of the document and how it looks at the end. The recommendations also provided us with some considerations that we'll need to take into how we actually write and present the document, and then different implementation approaches as well. So these are it's a way that we've sort of grouped the themes, and in terms of what we came up with recommendation wise, we can't sort of go through all 33 with you now, but we did look at specific areas of practice. And as mentioned just before, the idea of this and understanding different areas of practice for DFE specialist services in Australia and internationally and things that they have in common. We wanted to explore through consultation to what extent these practices are happening in DFE services in New South Wales and what the barriers are, how the quality standards might be able to support the implementation or improvement of good practice across the state and consistent practice as well. As well as the practice areas, we also looked at governance and leadership. So what that means is we sort of looked at or considering how far to take the standards in terms of whether or not they cover service governance, service delivery, or just practice. And we were thinking about how they might interact with current standards that exist across New South Wales, for example, such as ACES. And then we were also looking at, as mentioned, capabilities, frameworks, or specific skills that are key to the specialist DFE sector, and then what it means in terms of how we classify that, or how we introduce that as a standard thing across the state. Does it mean minimum qualifications? Does it mean a capability framework? What does that look like? And then we looked at the actual form of the document, so how the quality standard should be worded, structured, presented, and the implementation approach. So we'll be submitting some recommendations around implementation at the end. So we'll be sort of asking through consultation, how the sector want to see that implemented. How mandatory should it be? Should it be mandatory? Should it be, or how should it be monitored? And who's in charge of that? Whose role is that? So these are all areas that we're looking at through our research. We've just come up with more questions, so we're taking them out to you, which is something that we've started to do and already getting incredible feedback. I'll let Carrie talk more about the consultation process.
Thanks so much, Danielle, and a big shout out to Danielle, who led the bulk of the research work as part of the desktop research project. Did an incredible job, hit the ground running when she first came into the role. So I'm really excited to be able to share this with everyone now. Just finding my screen, sorry, everyone. There we are. The cursor. Building on the evidence base that Danielle's just outlined, we're going out into the sector, and and that's over the next 5 months. So we're taking time. We want to take our time to do this right, and we want to kind of get as far and wide as we can across New South Wales, and gather as much learnings as we can through in-depth consultations with the sector. So as Delia and Danielle have kind of alluded to, this whole process is critical to informing the co-design of the quality standards and making it into something that's kind of meaningful and workable for the sector. So we launched this part of our journey in early February with our first consultation session with the Delhi Women and Children's Centre. Such a wonderful team to have our first session with, and since then we've been hearing from many other services. So just to name a few: the Women's Cottage, the Centre for Women's Economic Safety, SSI, and Domestic Violence Service Management. So we're so grateful already, just the rich learnings that we're gathering from speaking to you all. And as the high-level roadmap you see up on the screen there shows, Danielle and I are travelling throughout the state, mostly from now through to June. So you can see the kind of areas that we're trying to target. And in July, we've kind of set some time aside in that final month to, I guess, more wrap up our conversations with the sector. So we're kind of putting a bit of time aside to do any online consultations for anyone that we might have missed in the process, who might not have registered on time to take part when we're out in different areas. We're kind of trying to loop back and dive deeper into some key elements or key learnings that we need to explore more through the process. There's still time to get involved, so we'd like to share now a QR code for everyone. As we said, this is such an important process. We want to hear from you. We want this journey to be a shared journey. We'd love to hear from you and to hear about your practice knowledge and experience. And we're inviting everyone to get involved in taking part in co-designing the quality standards, and as I said, making it something that's meaningful, truly meaningful and workable for the sector. So yes, the QR code's up there, and Danielle's popping the link in the chat as well. Thanks, Danielle. That will take you to the registration form, so you can fill out it's a very short form, just kind of giving us a bit of information on your role and your service, and when you might like to be involved in the process. And we're wanting to hear from the sector about your vision for the quality standards, so key principles, minimum requirements for services, core competencies for specialist domestic and family violence practitioners. We want to learn about your experiences of applying the good practice guidelines on the ground, and we also want to hear about from you in terms of considerations for future implementation. With, we want to be across the opportunities that the quality standards will bring, but also the anticipated challenges that services will have on the ground. So I'll pop now to, while we've got everyone here, we wanted to try and oops, and it looks like it's blank there. We were going to try and do a little Mentimeter poll. I'll just see if it loads on my next note. Unfortunately, it's not loading. So in the interest of time, I'll stop screen sharing, and just wanted to, how are we going for time there? We okay? We've got a few more minutes.
We're actually up to time, sadly.
Oh, okay. Well, I'll leave it there and we can reflect at the end. So sorry, everyone, the joys of technology. We'll hand over back to you now, Delia. Thanks.
Amazing. Thank you, Danielle and Carrie. And again, as Danielle's popped in the chat box, there's details about how to engage with the team. And as a follow-up, we'll pop in our weekly newsletter that mentee question so that anyone who was interested will absolutely get that. Plus the QR code, Sunila, absolutely. So thanks for that feedback. We'll follow up on those things. So we don't mind jam-packing you, do you? I mean, we haven't seen you since November, so we may as well add lots today for the sector chat. I'm really excited about the next presentation, everyone. So next I'd like to introduce Kat Gander and Joanne Campbell from DV West. Kat has over 3 decades of experience in the domestic and family violence and social justice sector at both a policy and practice level. Kat has held the position of CEO of DV West for the past 5 years, and prior to this, Kat has worked in advisory capacity to government and has and as a representative for both sector at a state and federal level. Kat has a comprehensive understanding of the DFE sector at a systems level and continues to advocate for change to support victim survivors' access to meaningful services, support and protection. Jo has worked in the domestic violence space and sexual assault sector for over 30 years in various roles as an advocate, counsellor, educator and manager. Jo is the general manager at DV West. Prior to this, she held the position of director at the Education Centre Against Violence. She's passionate about systems change to enable victim survivors greater opportunities to access to justice and healing. Today, both will be talking about DV West's We Are Safe and Living Outcomes Report. This report is the first Australian study to adapt a multi-country outcomes methodology that measures the efficacy of specialist domestic and family violence programs through victim survivors' voices. The report's findings indicate that domestic and family violence specialist workers require a complex and deep set of skills and knowledge to meet the diverse needs across complex domains, multiple domains for women and children's lives and across multiple service sectors. Today, Kat and Jo will cover what support victim survivors said they needed for safety and recovery from domestic and family violence, what the outcomes were for victim survivors after receiving these supports, and what are the learnings about practice for the domestic and family violence specialist sector. This is a great opportunity for our sector to hear about the key aspects of the DFE specialist practice centred work, particularly around people with lived experience. Without further ado, I'll hand over to Kat and Jo to tell us more, and we hope we'll have time for questions. Thank you so much for being with us today. Kat and Jo, welcome.
Oops. Thank you, Delia. I think you just did our presentation, but that's okay.
That's great. Just get the screen.
So before we start, I'd like to acknowledge that Jo and I are currently on the land of the Model Order people, and we'd like to acknowledge and pay our respects to elders past and present and to all Aboriginal people, and to acknowledge that sovereignty was never ceded, and it always was and always will be Aboriginal land. Just have a moment with our presentation. We've got like a disco light flashing, but it's not coming up yet. Here we go. Thanks for your patience.
Yeah, sorry about that. Okay. Yeah, so this is the title of the study that we want to present on today, and we really want to thank DV New South Wales and all of you for coming for this opportunity to actually share it, because we actually think it's a really unique piece of work and a really special piece of work, but it's also very current as well. So the title of the report is called We Are Safe and Living, and that's the other section of the title. Kat's just done a beautiful acknowledgement to country, so want to make sure our work is carried out on Darug and Gundagara lands. So we want to make sure that we really acknowledge the Aboriginal people and Aboriginal communities on those lands, because we have, you know, we're very privileged to be able to be doing this work on their land. This slide is just a little bit about DV West. Most of you probably know who we are and what we do. Last year, we were able to support 2,058 women and children. That's not just in crisis accommodation, of course, that's in outreach support as well. Yeah, and that just gives you an idea of the number of services that we provide.
Yeah, so we'd also like to acknowledge the unique contribution of domestic violence services in Scotland, Ireland and Portugal in developing this outcomes methodology that is consistent with feminist principles in making it possible to analyse and share outcomes internationally and nationally. The person who undertook the consultations across the countries to develop the outcomes methodology was Dr. Chris Sullivan. And as Delia said before, to our knowledge, this is the first time this methodology and style of study has been undertaken in Australia. So this study was undertaken by Dr. Leslie Lang, the Honorary Associate Professor, and Dr. Jane Bullen. Probably many of you will be aware of the work of Dr. Leslie Lang. She's been doing really important research on domestic and family violence, child protection, child sexual assault and sexual assault in this sector for many decades. The aims of it were to identify DV West's impact on the women and children and to inform our practice, and also to contribute to the discussion and knowledge on setting outcome measures for DV specialist services in New South Wales. You know, like currently at the moment, we use things like personal wellbeing index that is meant to measure where women and kids are up to, and it's completely not, I don't think it's applicable. Most of the women that we offer that to, as we have to under our contracts, don't want to use that tool. And we've said already about the methodology. It was received ethics approval. It's also been used in Ireland, Portugal and Scotland. And our sample size was around the same as what was used in those countries. Scotland had 47 domestic violence services use the methodology, and Ireland had 47 and Scotland had 31. And the numbers that we have on entry and exit are very comparable to those countries for the services. The demographics was 25% were Aboriginal women and children, and 12 were, women, and 12 were culturally and linguistically diverse women. The main age group was 26 to 35, followed by 36 to 45, and 63% of the mothers or carers had children in their care. So the study is based on the voices of victim survivors. And so the report captures what women said they needed, how they were supported and what the outcomes were for them. I think one of the differences in the study is capturing what women said they needed when they had just entered the service. And usually we're doing stuff around the feedback after women have had the service, but that's why I think what makes this quite different is that you're actually capturing that in a questionnaire at the beginning across a range of areas, and women are saying what they need. And there's also room for them to write in text if there's extra things or to make comments. So I think that's, you know, it's not complicated difference, but it's an important difference.
So we wanted to share with you some of the findings. Of course, we don't have enough time to go into all of it, but we did really wanted to highlight some interesting data that we thought you guys might be interested in. So this slide is were the top 4 things that women said that they wanted, the top 4 identified support needs that they had. And we were expecting things like support with safety planning and support with immediate needs to be in that top 4. But it was pleasantly surprising to see that women also in that time of crisis chose to want to have somebody to talk to that understood them, and chose they indicated that they wanted support with their healing. And those 2 themes are really a really important part of this research that have come out. The slide also talks to how many women actually received that. So these were the top 4 things, but 100% actually received talking to someone who understood their situation, and 96% received a sense of healing from a sense of healing emotionally from their experiences. These were some other top priorities for women: understanding the effects of DV, being able to make decisions about their own lives, support with finding housing. Some other top priorities for women, some other things that came out of the study were that where women identified not as highly, but they actually received a lot of. 64% of women wanted assistance with managing their relationship with their ex-partner, or contact with their ex-partner. So 64% indicated at the beginning that they wanted that, but then they reported 90.7 reported that they actually got it. 72% also indicated that they wanted information and support with their healthcare, but 97% received it. So some of the data indicates that women weren't strongly saying that they want it, but when they received it, they realised that it actually was really beneficial. We also just wanted to highlight some of the housing outcomes. In the exit survey, women were asked about their housing satisfaction, and you can see here that 90.3% of women were satisfied, and 9.7 weren't. Start safely rated really highly as the most frequent housing type on exit, so that was 44% of the women. And you can see here that 38% were paying 1/3 or more of their income, and 59% of women in the study were experiencing housing stress. So that's probably not a surprise to any of you out there in terms of the challenges women face trying to find housing, but having the support to do that and having the support to navigate what is a very tricky system. This study indicates that that's a really important part of the support that specialist services like us provide. This slide is about the child-related outcomes that women indicated that they wanted, and these were the most identified support needs related to their children. And this speaks highly of our role, DV specialist role, in advocating around child protection, where that's a big part of our role that often isn't talked about, and the practice around isn't talked about in detail. So you can see here the top 4 things that women wanted: information and support with child protection, going and talking to DCJ with mums, understanding the impacts of DV on their children, and assisting with parenting arrangements and restoration. what was interesting with some of the data here was that 52.9% identified that they wanted, so only 52.9% of women identified they wanted support with safety planning with their children, yet 97% received this. So that part of the data is telling us what we all know, that women are initially reluctant to identify their support needs around their children until that trust is firmly established. Okay. This is one of the women's voices that came out of the study that shows how important our child protection advocacy role is.
So the study showed that 10% of women said without the support they would not be here today. So for this group of women, specialist domestic violence services are life-saving. They provide homicide prevention services. And, you know, I think that it's something that isn't really recognised.
I think the weather's probably impacting the signal slightly here, but do take a look at this slide, everybody. Great stuff.
We're back. Thank you, Delia, for jumping in like that. It's brilliant. So these were, you know, some of this was also that we gathered this was just particular comments that women made on their exit questionnaire. And, you know, so, and we do know that, I mean, for many of our services, we are the key place where the safety action meetings refer to. I know for some of our services, 80% of the women approximately that go through the safety action meetings are referred to our services. But again, I still do not think we get the professional recognition of the specialisation that's really required to do this work well. And, you know, that at the end of the day, we do save lives.
Okay.
And I think it's something as services we should talk about more when we have the opportunity, because I think that there's still a bit of an idea that we give people a bed for the night and a can of baked beans and, you know. So this is another slide, just a response from one of the women highlighting our homicide prevention role, that the service saved her life and put a roof over my head when I had nowhere else to go. Also kept me safe and protected. I received emotional and the most priceless help from my support person, and without her, I wouldn't be here today. Thank you with all of my heart. So this is an interesting thing, you know, and I don't know how we capture this in standards. I'm interested. I mean, I think this is a very interesting part of our work. But, you know, what we are in lots of ways, we are change agents. You know, if we get the right kinds of support happening, then women are able to make some really important changes. And 95% of the women in this study said that they reported being able to make personal changes, more ways of keeping themselves safe, more understanding of DV, how it affects me. They've got more information about options, more confident in their ability to make their own decisions, better able to find and keep suitable housing, more on housing, and better able to address health and well-being. And, you know, in that, I guess this is, you would hope to see this, but we were higher than any of the other studies we've seen, so we'll skite for a little bit, but any of the other overseas studies, but 100% of all the women endorse the feeling that workers cared for them, respected them, supported them, respected their sexual orientation, gave them the support they needed, encouraged them to get what they needed from other services, respected their decisions, particularly about relationships if they had a violent ex-partner or an abusive family member. So again, you know, supporting them to make their own decisions. I really love this quote, and I think it's really important. There were a lot of things that people did put, but they help you be the person you used to be before he changed you. And I think perpetrators of violence and control commonly attack women's agency. And this is done through a range of tactics and a spectrum of behaviour over usually a period of time. So, often when women come to us, that's the experience they've got. And so much about them has been undermined and their agency has been really damaged in that relationship. So, listening, believing, validating and providing information support can actually counteract the impacts and effects. So and I think, if we just look back at some of the key things in this study, I really think that there's a kernel of something very important in that to be an effective specialist service, that you need to have those attributes with your workers, your agency, in your practice. I think that's, quite often people can think, oh, I've just got to get on with the tasks in the plan. I've got to get women to get moving, and they haven't made their appointment for this. But there's so much more to the work. I mean, getting those things done are important, but the way in which they're done is equally, if not more important. It actually, this week I did have the luck of attending Kate Alexander, who's the Executive Director of the Office of Senior Practitioners, and her PhD. And, it's a brilliant piece of work. But one of the key things that it really talks about is the importance of attitude. Mm. And so I think there's some sort of synergy with that. Can we go to the next one, Jo? We might just skip to the last one and come back to that one. Yeah. So some of the key learnings. Emotional support is just not a secondary sideline thing. This was the key thing that women wanted. It was the number one thing. It's the foundational keystone that enables change to occur. Emotional support, skills, knowledge, and partnering create an environment of trust and respect that enables healing, growth, and change. So, if we look at the key things, the importance of specialist knowledge, staff providing non-judgmental listening and validation, the importance of partnering with the victim survivor, the importance of staff having the skills and the knowledge to effectively and confidently advocate across multiple complex systems, including the child protection system. These are really important attributes we need to have in the skill set of our services. And when the above are provided, women and children benefit by setting and achieving life-changing goals. It's not us that achieve the goals, it's them. But the way that we are in our behaviour and our skills and knowledge really can contribute to that journey. I think as well that this study does support some of DV New South Wales good practice guidelines. This area, particularly victim survivor centred practice and empowerment, which is Principle 4, and Principle 6, non-judgmental support. So I'm just going to let Jo flip back now, and we'll go to just look at how we think this study fits into some larger pieces of work. But before we do that, I just really want to acknowledge the women that were the victim survivors that contributed to this study, and for giving their time and really giving us some knowledge. And from that, for us, we've really been able to make some changes as a service. Once Jo's gone through this, we'll let you know where you can find the report. In the report as well, it has the questionnaires that we use, we would definitely do that a bit differently next time, but it's based on what is the multi-country model, and it really is just about adapting that to local change. I think what we'd find out a little bit more about the perpetrator if we were to do it again than we did this time. And I think as well that it's important work for DV New South Wales in terms of the outcomes that we get set to meet in this study has, you know, really can contribute to those conversations with the peak, because, you know, the outcomes speak for themselves. Thanks, everyone. I'll pass over to Joan.
Thanks, Kat. So this slide is just being put together to make the links with how this report links to the national and the state plan, and the specific actions that it links to. One of the things we feel strongly about is that we think this piece of work really can contribute to an approach around building a evaluation framework for services like ours across the state and across the country, simply because it's a methodology that fits for our services, and it's a methodology that actually is women's voices are front and centre of the methodology. So we really think that would be useful. And as Kat mentioned around the personal wellbeing index and the COS, the client outcome survey, they're quite generic. They don't fit our services often. They don't actually show that the level of the complexity of the work that we do deliver. The other thing too that I wanted to say on this is that we would like you guys to share the report in your advocacy at a local level. It's something that might be useful for you to explore, because there's a lot of information in here about what's important to women, and that might be a useful thing for you in your advocacy at the local level.
Thank you. Thank you very much.
Was that too long?
Thank you both. We have 2 minutes, but just want to note the significant work that this is, and I think this really lends itself so well to some of the quality standards work actually that the team are doing. I'm really glad that you've got info@dvwest.org.au, because I think there will be definite follow-up. I don't know if you were seeing the hearts, the claps, the thumbs up throughout that presentation, and again, really value that you have really centred voices, and you answered a question I was going to have, Kat, which is around the changes that the organisation makes, even though you're doing such great work, the learnings. So that's great to hear about the changing of the questionnaire. So I'm just going to close up, and I'm sorry we didn't have time for questions, but that brings us to the end of a very jam-packed sector chat, but what an incredible sector chat. Thank you to all our speakers and to our members for joining us here today. We've covered a lot of ground. We're all doing some incredible, amazing work. We hope we got you excited about the year ahead. And obviously, all the information we provided today will be in our newsletter. You can email us at admin@dvnsw.org.au. So check out the newsletter. We'll make sure DV West gets a section as well with some of this key information. And we're really excited about celebrating the 50th year. So looking forward to seeing everyone very soon. And don't hesitate to reach out. See you all soon. Bye.
Bye. Let's have a look at our chats. Have we got any questions?
Thank you.